It's been an interesting past month. I just wanted to give some advice to people who had pilonidal cyst surgery. I unfortunately developed a pilonidal cyst, which I believe is, I have back problems, really, really bad back problems. So I get epidural steroid injections, and they go into your lower back. Mine are in the lumbar area, but they actually go like through your butt crack a little bit. Well, not a little bit. They actually go through your butt crack to give you the injections of the steroids, and kind of to like infiltrate that area with steroids, to reduce inflammation, and it just really helps with the pain. And the last time that I had them done was in September, and in December I started getting a very painful red spot right like at the very top of my, I think it's called gluteal cleft, but butt crack, whatever. It was at the top of my butt crack, and it got, swelled up and hurt, and it was red. For a couple days I could barely sit down, and then it went away. A month later it popped up back again. It got way worse. And I was scheduled at that time to go into pain management to get looked at to see about possibly getting another epidural steroid. But they said that, you have a pilonidal cyst, it's infected. We can't perform any injections on you until you get this surgically removed, because if we go ahead and stick needles into that area and there's an infection, we could push that infection into your spine and you could get meningitis. So, I definitely have to get the epidural steroid injections for managing my pain. And so it wasn't really an option. I had to do something about it. I had gone to my PCP, and he did diagnose me with a pilonidal cyst and gave me 20 days worth of doxycycline antibiotics that have to be taken twice a day. And I've taken that in the past, and it works pretty good. They're just kind of a different kind of antibiotic, because you can't like eat 2 hours before or 2 hours after you take them. So there's like a 4-hour period twice a day where you can't have any food. It says you can take like eat like crackers or something if it upsets your stomach, but it never really did that to me. They're pretty easy on my stomach for the most part. But yeah, so when I went to the pain management doctors and they told me, you need to see a surgeon, I went to a surgeon, and he said, yes, that's a pilonidal cyst. It has a very high rate of recurrence. I would recommend surgery. So on February 14th, Valentine's Day, that's how I spent my day. Got up at 6 in the morning, had surgery at 8 a.m. And surgery was pretty good. It went well. I had a drain put in, and they took out a 6-inch long by 4 inches wide by I think almost about 2 inches deep worth of skin in the gluteal region where the cyst was. It had developed a cyst that had turned into an abscess and a tract, which meant it was like starting to tunnel down. It was starting to get very bad, and that's something that's really common with pilonidal cysts, is that they start to like turn into tracts and tunnel down, and it starts to spread. So really the best thing to do with those, if they kind of turn into an abscess and antibiotics and home care are not working, you really do have to have them surgically removed. This is the first surgery that I've had. I had my wisdom teeth taken out, and I was put under for that, but the first like surgery on my body, I guess, that I've had, my lower body besides my mouth. And surgery was about an hour long. It took a few hours to recover. When I got home, it was I had a really bad headache, and I did throw up, but I think that might have been from possibly not having caffeine, because I drink coffee a lot, which I have to cut down on that anyway. But it could have been from that, or it could have been the medication, because I was completely put under. And they said that they put me like at a jackknife position like this when they did the surgery, so that my butt was in the air so that they could, see everything. And when I got home, I did throw up. They gave me Percocets to take, and I definitely needed them. It's been kind of a rough recovery a little bit. It was a lot harder than I thought that it was going to be. I originally thought that I was going to be back to work within a couple of weeks, but I have a drain in, and it has been in for 4 weeks, and this is the drain, which I'm sorry that it's gross and bloody, but if you guys have the surgery, that's what you're gonna have attached to your body. It's attached and a couple inches away from my butt crack where the incision was. I think the incision is about 6 inches long, and I have to drain it twice a day. The doctor doesn't want to remove the drain until I'm draining less than 25 milliliters a day, and I am at 70 right now. If you have pilonidal cyst surgery, I recommend being very careful with your drain. Maybe making sure part of it is tucked into your clothing so that when you get up and down, it doesn't get stuck on anything. Unfortunately, I was sitting down on my couch, and I have a reclining couch with different reclining chairs. And when I was sitting down, the drain tube fell between two of the cushions, and I went to get up and it yanked on it. And I was in so much pain. I didn't even sleep that night, went to the doctors, and he said everything looked fine. It wasn't infected, but because when I had pulled on that, it actually had moved some of the tissue that was healing, and it took my my drain output from about 65 milliliters today to 115. So I'm still at 70, and this was like 2 weeks ago, and it was like 115, then it went down to like 100, now it's down at like 70 a day, and it's the recovery has been a little bit harder than I thought that it was going to be. I was very sore the first few days because you can't lay on your back at all. Like I just now 4 weeks later, I can start to lay on my back, and I couldn't do that before because it was just so painful. But the first couple of days I was very sore. You have to use your arms a bunch and your abs to be able to move and to twist back and forth from side to side. If you can lay on your stomach when you're recovering, that's something that you can do too. But because of my back issues, it just makes me really stiff and very uncomfortable. So basically for about 4 weeks, I've been sleeping on, one side to the other. I can't really do too much around the house. I can't clean too much, or do anything. So if you have something like this going on, you're going to want to make sure that you have help around the house, help with your laundry, your dishes, somebody to help carry, groceries or trash out of the house. Just take it easy. Take this time to be your laziest, just lay around and, relax and stuff and watch TV, read books, sew, crochet, can't really use a sewing machine because you'd have to sit, but I'm starting to be able to sit for longer periods of time. It is getting better. The pain is definitely, a bit more bearable, but when I yanked on that drain, it really hurt. So I would recommend, just being real careful with your drain when you're sitting down, standing up. Make sure that you know where that drain is at. Make sure that it's not stuck on anything. And, hopefully if you have this done, your recovery will be a little bit easier than mine has been and a little bit quicker. I just am taking a while to heal. The doctor did say that he did take a pretty healthy amount of skin and tissue out. So that is, it's got to fill in. He stitched it shut. Some people have to do packing and they don't have a drain. They actually just pack the wound and it granulates up and heals from the inside. Mine was stitched shut, and they actually stitched my butt crack too. Like a few inches down into my butt crack was stitched up a few inches above it. And I'm starting to get uncomfortable right here, so I have to stand up. But yeah, it's you gotta move around a little bit, stand, sit, move side to side. But that's kind of been my recovery so far for the past 4 weeks. And hopefully I get this drain out. I've been off work for a month. I'm supposed to go back in 2 weeks. I'm really hoping I can go back in 2 weeks because due to my health condition, I have to do intermittent FMLA for procedures and when I throw my back out because my back is pretty jacked up. So I only had 6 weeks, but I did talk to my HR people and they said, if you have to be out a little bit longer than that, if we've done without you for 6 weeks, if you have to be out for 8, that's justifiable, like medically. So they told me not to worry about it, but I really hope I'm not out because it's been kind of dull. It's been nice to be off because this is the longest that I've been off work since I started working. you know, when I was 18 or whatever, and I'm 33 now, so this is the first month off I've had from work in the past 15 years. So that's kind of been nice. I just wish that maybe it wasn't my butt that had the medical issue that got me off. But yeah, that is what's going on so far. I do have some pictures of the wound. If I can figure out how to attach them to this video, I'll do that. There was a lot of stitches. The first week after surgery, he did take some stitches out. The second week, he took the rest of the stitches out. And then I have the drain stitched into me, so that's the only stitches that I have. It's just the drain. It's like stitched into my skin. So, yeah, that is what's going on with me so far. If I have any changes or updates, I'll go ahead and upload that. I forgot to mention in the beginning of the video when I was talking about the steroid injections that I got in my butt crack. I believe that this cyst developed because when they pushed the needle in to inject the steroids, unfortunately it probably pushed in a hair follicle, and then that hair follicle became infected and turned into a cyst and an abscess and all of that. That's usually what pilonidal cysts are from, is from like impacted hairs that, you know, start growing underneath the skin. So that's what that whole part was about. I forgot to include that. And then also I have some tips for bathing. I'll make another video about that because it's a little hard to wash your hair when you have a drain attached to your body. So I'll make a video about that too. All right, bye.